Welcome to the Panza Panza Forum. In the Yoruba language, the word panza is usually injected into poetry to express an uncomfortable, uncensored, and inconvenient truth. The Panza Panza Forum is candid conversations about the life of African immigrants in America as it relates to their adaptation to their new home. While some may find it easy to integrate and can balance between retaining the original African culture while accepting the culture of their new home, many continue to struggle to find a balance between both worlds.
Hello and welcome to Panza Panza Live. This is a podcast where we discuss the lives of African immigrants and their assimilation into Western society as they raise younger generations in a country that is quite different from their own. We also explore the experiences of children of immigrants as they balance the African and Western cultures. We present to you this informative, interesting, and expansive dialogue about the intricate experiences of African immigrants in America.
Hello, and welcome to another episode of Panza Panza Podcast, a podcast where we explore the stories, the untold stories, and the lived experience of African immigrants navigating life in the diaspora. I'm your host, Kemi Seriki, and my guest today is Dr. Manka Nkimbeng, an associate professor at University of Minnesota of Public Health, a community-engaged nurses scientist. Dr. Nkimbeng is an African immigrant whose personal and professional journey fueled her research on health, equity, aging, and dementia, especially among minority and immigrant older adults. Dr. Nkimbeng earned a Ph.D. in nursing from Johns Hopkins University, a master's degree in public health from Boston University, and a Bachelor of Science in nursing from University of Massachusetts Amherst. She's also completed the Robert L. Kane Postdoctoral Fellowship at University of Minnesota. Dr. Nkimbeng's work is deeply rooted in community engagement. Her research examines how factors like discrimination, acculturation, identity influence the health and the well-being of older African immigrants. She is also the recipient of several prestigious awards, including 2024 Bush Foundation Fellowship, an NIH Career Development Grant, and a selection as a Robert Wood Johnson Foundation Health Policy Research Scholar. In this episode, we'll be discussing two studies that she conducted with other fellow research scholars titled Where to Retire, Experience of Older African Immigrants in the United States. And the other research is titled All I Know is That There's a Lot of Discrimination, exploring how older African immigrants navigate the question of belonging, health, identity, and what their story teaches us about aging in a new life. So, Dr. Nkimbeng, thank you so much for joining me today. It's such an honor to have you here.
Oh my God, thank you so much for having me on the podcast. It's a pleasure to be here. And it's kind of strange hearing some of the things about me. It's always like, oh wow, is that who are you talking about? Is that me?
Of course it's you. Of course it's and which I'm gonna go first into your personal journey and your identity, because a lot of time as immigrant, people don't know how we came to be where we are. They just know we occupy certain space, but they don't know the challenges we face as we acquire this position. So as I regularly ask my guests, can you talk a little bit about your background to our audience as to where you were born and where you spent most of your childhood and adult life?
Yeah, happy to. So I am originally from Cameroon, Central Africa, officially Central Africa, though a lot of people think it's West Africa. I came to the US in high school and then I completed the rest of my education here. And let's see, as soon as I came to the US, I was very engaged with the community. And so I've always been in and with community to do things. And so all of my work has always just come from that drive and passion of the community. And actually, working with the community started happening before I came to the US, because I grew up with my grandparents, grandma and grandpa, and they took me to all of the older adult events, the church groups, the Jangis, the Susus, depending on what community you're coming from, any of those groups that are older adults back home attended. I was that young child. I was always there with my grandparents because I grew up with them. So I have always been in community. And so it just makes sense that everything I do is with community. And so when I came to the US, and while I was getting my degrees, I also still continued to spend a lot of time in the community. And my research is actually born from what I was seeing in the community versus what I was seeing in the academic literature. I anticipate that there might be a question about that. Otherwise, I can just talk about it too now. Yeah.
Yeah, you should.
Okay. So the research that I do with older adults actually came from in my professional life. While after getting my master's and moving to Baltimore, I was working with the older African American community in Baltimore City. And that project, it's a huge project now, but we're part of the clinical trial that built up the evidence base of that project. We were working to ensure that older adults are aging in place. So it was a nurse, a handyman, and an occupational therapist going into the home and finding out what they needed to be in the home so that they can continue aging in place and not leaving their home, which is the familiar environment, to go to some sort of facility type setting. And so when came time, that I was doing also while pursuing my Ph.D. And as I was seeing what was happening, the benefits of that program, like, okay, I think I want to do this kind of program for the African immigrant community, because on the weekends, I was going to our cultural groups, I was going to the community, and I was seeing the older African immigrants who could benefit from this program that I was part of and it was working. And so my mentor asked me, she's like, well, how many people have physical function limitations in your community? I was like, let me do a literature search. I went online trying to find a literature search, did not see any data on that community. How many people have whatever medical problems I was seeing in my professional day-to-day life? There was no data on the African immigrants. She's like, it's difficult to intervene on something that you do not know at all about. And I was like, yeah, it makes sense, because we don't have any burden information. We don't know who needs what. So she's like, you might need to do a study to actually explore the burden of these conditions. And so that's how
That's
my dissertation came to be.
Wow, that's so wonderful. And, even before, you grew up here, I wanted to ask you, even before you go into this question, because I'm so excited about this. As a child of an African immigrant, how did you navigate the duality of both African and Black in America? Because you say you work with
Mhm.
the African American community of people of
Mhm.
color. Were there moments where this identity were in conflict with each other, or do you think that being both African and Black and African comes with a unique challenge?
It does. It comes with a unique challenge. And I think for most immigrants, there comes a time when you have to decide how you're going to pursue. So for me, it happened very early on. So came, I came to the US in my teenage years and went to high school. And you
Mm.
can imagine what happens in high schools. There's a lot of kind of insults and discrimination against you because of your accent, because of the way you look, because of the way you dress, because of the types of foods you ate, and all of those things. And so in high school, I would struggle a little bit of trying to figure out, do I act American? Do I just stay in my Africanness? Do I try to mix? And so you kept on having this kind of back and forth. But I think one of the things that was good, really grounding for me, at least when I was in high school, was that there was a huge Cameroonian population where I grew up. And there was a huge active community that I was engaging with very frequently. And so by being able to engage with that community frequently and also going to school, I began to come to a realization that I have to live in both spaces. When I went to high school, I would be as best as I can. Obviously, I haven't lost my accent, and it's difficult to use accents, although people, do what I needed to do to achieve the goals that I had for myself, get my education, be a part of different clubs and games and activities so that I could get those scholarships. So I would just do that to be able to succeed in that domain. And then on the weekends and back in community, I was part of my African cultural community. We're part of the African festival. I was performing African music at African festival. So being in the community that I was able to really just live to the best of my ability across both worlds. And so that's how I just grew up in America, living in between both worlds.
You are so fortunate to have that Cameroon community. very grand because not so many African children do have that to be able to move from one stage to the other. And imagine when you go to school, is a different environment. You have to behave differently so that you could be accepted. This is so challenging. And many people who are, and people will think just because you're Black, you shouldn't have that kind of problem.
No. I think a lot of the discrimination I faced in school was actually not from, if you're thinking about the racial ethnicity, it wasn't from the whites per se. It was actually from the people, brothers and sisters who were stolen from Africa and brought here. That's really kind of a lot of where there was talks about taking the opportunities. And it's almost like when we all are discriminated against, then you start fighting within yourself. That's kind of what was happening. Most of the discrimination I faced wasn't necessarily, don't get me wrong, there's discrimination from whites. There's a lot of systemic discrimination that happens that benefits maybe whites more than all of the other minorities. But in terms of the interpersonal discrimination that I was facing in high school, a lot of it came from our brothers and sisters who were stolen from Africa a long time ago. So it's very interesting in that way that somehow both of us who are in a minoritized position, we've been put to be fighting against each other when we're both not winning at all. So it's one of those fights where who you fighting, yourself? That's not where the struggle is, actually against the larger system.
And the American society didn't even teach them. Somebody who just came from Russia yesterday, they are also immigrant. Somebody who came from, anywhere in Europe, and they are new in that country will not be attacked as taking their jobs or opportunity for them because they are not being projected that they are.
Unfortunately, yeah, the racial component often comes into play at that time. Yes. Yeah, it's like whenever there's always a racial component and an ethnicity component and then a country of origin component. So Africans often have like this multiple intersecting ways in which we can be discriminated against. But yeah.
And many people don't like to talk openly about this. And it's part of what I believe it should be talked about because we cannot just keep silent. Because according to your research, that's part of what you are now navigating through your research work, which you're going to talk about later. So what role did your family play in shaping your academic success? Because many people say African immigrant children, they come here, they're so successful. What is behind this? They grab the opportunity and all that stuff. What were the specific cultural value or expectation plays in your mindset and your motivation?
That's a very good question. That brings up a lot of things that I can think of. So the very first one is depending on how your family got here from Africa. If your family came as a result of war or civil war or genocide or whatever, there's a refugee status. And when you're coming, you've survived war, the goal is to be able to succeed, do what you can to succeed and build a new life. Then there's also a lot of our parents who came here for education, for greener pastures, for jobs. And you can think of, if I'm going somewhere for greener pastures, I got to work hard. I got to work hard. So that's how my parents came here. So I would speak for that and how it impacted kind of my upbringing. My dad came here for education. Education was something that was part and parcel of the family. There was no qualms as to if the next level of education was something you contemplated because we knew that was the reason he came here for greener pastures. And it was already part of our family culture that we were going to do our best to succeed because we saw him working really hard to succeed. And so it wasn't something where we had to question or not do. That was just we knew that was going to happen. And then the other thing that we talked a little bit about that I wanted to highlight is the role of the ethnic enclaves or the communities that we settle in. Many of us settle in communities that have other people from our country of origin or however identity we are. And that's a good thing because for me, that's where I was. And so that's what everybody was doing. And so because I'm in a community that all of us we're around the same level, we're doing the exact same things, it was just what we did. Yes. We just conversed, we supported each other. I mean, my community that I come from, all of us around the same age, even though our families were from different villages, we're cousins. So, Africans don't have distant relationships, actually, it's brothers and sisters. But to explain it to our friends who were not part of the community, we just said we're cousins because they could not understand what that relationship was. Like my sister, like, no, they're not your sister. So we're like, we're cousins. But that's how we were. We all were cousins. We worked together. We applied for grad school together. We played sports together. We did all community things together. And so being in that community where everybody was striving towards the same thing, we supported each other and just looked out for each other. And so that's kind of that culture and that community where I grew up in.
Wow, that's very powerful. That is very powerful. And that's a lot of things that people don't understand. And it could apply to any immigrant community here as well, whether they come from Europe or they come from Asian countries, because they live within the same community. And that motivation comes in and sharing information. What are the opportunities out there? If you are not doing well, what is wrong with you? What is going on with you? You better, you see so person where he or she is now. Why can't you do what you have to do for yourself? That's very powerful, and I really appreciate that. So, how do you see your identity now as a bridge between African roots and your American identity?
You answered the question, and I would. It wasn't until very recently that I actually came into that identity, which is funny because when I became a Bush Fellow, my goal was to try to build a coalition of African immigrant serving organizations in Minnesota. And so, as I was talking about this with a lot of friends and a lot of community partners that I work with, they're like, "Oh, yeah, that makes so much sense. You're a connector." I was like, "Oh, yeah, that's pretty much what I do. I listen to what people need here, and by the time I get here, I'm like, oh, you should connect with this person. I listen to what is happening here, and I'm always trying to connect. And then I realized that it's really what I've always been doing. I'm in the research space. I'm thinking about the research and I'm thinking about that. And then I get into the community. I'm thinking about the culture. I'm like, how do I connect those things? So really my whole life and life's journey right now is really just connecting community and academia, research and community and culture, and really just connecting in a way that would improve community health. And so that's pretty much what I've been doing for the longest time, just connecting people. But I didn't make that connection.
Yes, yes. Thank you so much for that. I know we talked about what inspired you to focus on your research on older African immigrants in the United States, given the limited attention to this group. Why do you think that research on African immigrants tend to be overshadowed or sandwiched between the studies of African American, the Caribbean, and the Latinos?
Ooh, so this is a loaded question. I think there's two sides to the story. The first side is the side of the researchers, the community, and the system. So the researchers, if you think of the way research has always been done, they have a project, they come up with an idea, and then they advertise, maybe on radio, on flyers, on buses, whatever ways they have always done their advertising. And then they just recruit people. But that doesn't get to our people because we're not in those spaces. And so oftentimes what often happens in research is that minoritized persons and Africans in particular they typically call them the difficult to reach community, or actually they say hard to reach communities. Yes. So that's the one side of it. And then the other part of it is that our population has been steadily growing and it's not been recognized for the longest time that the number of African immigrants, and in particular, the number of older African immigrants is growing really, really fast. And we need to think about how their needs are different from the general community. And so there's been a lot of work now from those of us who are in academy to think about we cannot join all persons of African descent together. The culture of those who were stolen from Africa or persons who were descendants of slaves, the culture of those who were from the Caribbeans and the African culture. There's similarities because they are all persons of African descent, but those generational issues and travels have put a distance between our culture and their differences that we have to think about. And so now we're calling that into attention, and there's a need to disaggregate data so that we understand what's happening within each cultural group. So that's something that a lot of us in the research community are doing now, and we're pushing for policies and systems like census and all of those databases to be disaggregating it. So that's the piece that is kind of like the system and the academic facing. Then when it comes to the community, there's a lot of things that have been done wrong in the past with research that we know. It's funny because I was at an African immigrant diaspora conference over the weekend. So that's the other thing that was very interesting. And one of the persons talked about how There's an African immigrant who would not take part in research because of Tuskegee. And this researcher is like, how do they know about Tuskegee? I'm like, bad news travels very fast. So there's been a lot of injustice that has happened. It doesn't matter if it happened to our brothers and sisters who were stolen. African immigrants have heard that, and they've heard things about how research has not been done right. Henrietta Lacks, Tuskegee, this pain research with African American women, all of these types of things that have happened in the past. So that has put a sour taste around research and interfacing with the healthcare systems. For all persons of African descent, doesn't mean there's just the descendants of slaves that experienced that who were taking those. All persons of African descent have taken that into account. They're like, you think they will not do the same thing to me? They did that. So they're going to do the same thing. So we're afraid of research. And then the other thing is that for many Africans, like we think of some of those outreach campaigns that we used to have back home in Cameroon was vaccines. A lot of it was around vaccines. And they'll just gather kids at school. I remember they'll just put us in a line and start jabbing us in the arm.
Yeah.
Like nobody had an idea what they were trying to do. Why were they jabbing us in the arm? That was a scary, a traumatic experience for a lot of people. And so people do not want to interface. They think about some of those memories. So they don't want to interface with research and healthcare system. And so you have these two bad things coming together for research. It's so important then that when we as researchers want to do research, we have to think about what is happening at a system level, what is happening at the community level. And that's one of the reasons why I am a community-based participatory researcher where I'm pausing to go into the community and really have a conversation with everyone to say, this is what I'm doing. This is why I'm doing it. This is how I'm doing it. This is what will happen when you're part of the process. This is what will happen with the findings. Really walking people through those steps to do it differently so that they understand why and how this research is important for us as a community and also for the general society. And that's how we're doing it differently so that we're really getting the research that is important for our community out there and doing it with the community together because the past has not always been done right in the past. So we have to
And
do
I'm
it differently.
so glad that you are actually going into the community because I've spoken to so many people who are in academia and talk about research on African immigrants. And they say, oh, African immigrants just don't believe in research. They just don't, they are very reluctant to participate. And someone like you who take your time to explain, to let them know why this research is needed, how it's going to be beneficial for their future and the future generation to come, how they're going to understand that they are actually culturally sensitive to your culture, to understand that the way you see things is different. So, by you participating is actually going to bring a lot of understanding. So whether you go to the hospital, they will be trained, the nurses or the doctors who are taking care of you will be trained or understanding that this person from this culture has to be communicated to in a different way for them to understand why certain things is needed. And I'm glad you are part of that connection within the community because I don't know whether we have many of our people in academia. I don't know how much of them is actually integrating and doing so much in this because it takes patience and understanding and special interest to show that this is my community. I'm going to bring the best of the best to them. And I'm going to, bring all these things out so that they could get the best of the subject. Thank you so much for that. So I want to go to the question on your first paper, your research paper, where to retire. One of the biggest questions your studies raise is where is home? For some people, it is clear, and for others, it's complicated. What were some of the main reasons older African immigrants gave for wanting to retire, either in United States or back in their African countries?
Ooh, that's a loaded question because I think some of the papers we're talking about, the data was collected in 2018 and 2019, and I've been asking some of those questions today, and it's very dynamic. So I think what we typically see is two main camps of older African immigrants. There are the people who came here and they knew that they were going to go back home and they prepared themselves to go back home. And so they're preparing to go back home. So we have those people who came here, they worked really hard, built a nice house, maybe in the village back home, and their plans are to go back there. And so we have a really good group of people that are like, that's my plan. That's what I'm going to do unless a health thing affects me. That's the one group. And then the other group is like, yeah, it's funny because they all still had those dreams. I had those plans. I was going to go back home, but guess what? All my friends there, they were in different life spaces now. They're doing different things. I remember one of the participants talked about how one of their friends was now some big minister and they were really no longer in the same social circle, and it would make no sense to be, they couldn't really connect anymore as they could. And so it makes no sense now to be trying to be like as close as they could be to that person. And so it's like, yeah, everybody has moved ahead. All my kids are here. My grandkids are here. If I go back home full time, what am I going to do? And so then that's when they're like, I might stay here. But the most interesting thing that I find then and now is this idea of back and forth. We're calling them now transnational ages or transnational aging, where a lot of people are doing. I remember there was one lady that was doing 3 different places, but so a lot of people are doing, for those of us in Minnesota, winters outside of Minnesota. Yes, they don't want to stay in Minnesota during the cold weather. They go somewhere else. Most of them would go back home to Cameroon, Nigeria, Liberia when it's cold and stay there for a while. And then they'll come back here in the summertime to stay with their grandkids. And then this particular person that I remember talking to is a mom who has kids in London and here and then Nigeria. So do the 3 times a year. She would America for some time, London for some time, Nigeria. So she was doing this back and forth. And so we have this whole group of transnational aging. That raises a lot of questions around healthcare access and healthcare that is very interesting. And we're beginning to realize that the healthcare system here is not even equipped to do that. Because if somebody's going to stay in Africa for 6 months, they need 6 months worth of medications. But most insurance companies, the max they do is 3 months. And so it's like, we're beginning to think about how do we ensure that their healthcare is still taken care of so that they're able to do what they need to do. But home now for a lot of people is no longer a physical place. I know that was the question you asked. It's really more along the lines of where's family and where I am at this point. And those notions of home where, let me correct myself. If you ask them where home is, most people will always say back home. Like the thought of home, but the practice of home, it's now where the heart is and where the family is. But for most African older adults, home is always back home in the African country of origin. When you ask them, oh, where's home? That's like, oh, yeah, I come from, that's where I grew up. That is. But then when you say, how do you consider home in the context of you residing? It's often now thinking about family where they are residing, which is different. Yeah.
Yeah. That's so amazing that, you're able to connect all these, where do you call home? And one thing with a lot of us African immigrants is that like you said, majority believes we're still going back. Even though they could spend 30, 40 years in this country, 50 years, they still believe they are going back. Many will build houses that their children and grandchildren will never go back to live and use every penny that they have to build that home. But then who is going to inherit it when you pass away? Are you just building it for the community? Do you even think about, the aspect of, all these things?
No. Yeah. Legit questions.
And I imagine healthcare plays a big role. The US has strong health infrastructure, but in African countries, we often, you spoke about it a little bit, often have a stronger social and community ties, which is what we feel that, we need to go back home. How does your participant navigate through the trade-off between health services and social support?
No, I think the bottom line comes to they try to do the transnational, and that's the navigating that they do. So most people would think about, all right, what do I need when? So if I'm coming to America, or if I'm going back home, let me do the opposite. They're here and they're going back home. They get all of the tests they could possibly do. They get all of the medical procedures they could possibly do to do everything they can. They gather the medications, they go to the Sam's Clubs or wherever and buy bulk of everything that they could possibly need because they know that when they go back home, it becomes challenging. And for most of those people, there's always still room. I know a lot of families are like, yeah, if there's an MRI or something major that is needed. Fortunately, many of the healthcare systems back home don't have some of this high-tech equipment. And most of it, when they do, it's often really far away. And so it's almost like when that big house is in the village, maybe the tertiary facility or the tertiary hospital that might have high tech hours or even more hours away from the village. And so you'll find that they do all of the testing and then they go back home and they try to frequent and get some checkups frequently. But if there's a problem, you often have people saying, get them quickly to the big facilities to see what is happening so that if something needs to be done, we need to do it sooner than later to bring the person back here. But yeah, that the challenge of healthcare infrastructure in Africa is really impacting a lot of people. And for others who have conditions that are kind of really, really tricky, I often hear a lot of people with diabetes begin to worry about diabetes and insulin use, worry about they really can't go and stay home long because depending on a crisis, might not be a system, a healthcare infrastructure where they're residing. So healthcare access and healthcare infrastructure impacts that decision a little bit, actually, a lot. It is the opposite now when I'm dealing with persons that are living with dementia. A lot of families, like, I cannot pay somebody to take care of my family member here well enough because I can't afford to pay somebody to come into the home full time to support them. But I can pay multiple bills back home to support them living with dementia. So there's also that navigation, the navigation for chronic medical conditions that are not necessarily cognitive and require 24-hour care is different than a condition like dementia or other conditions that require more kind of like more acute care, but not necessarily a lot of infrastructure care. So it's a lot of calculation that families are doing. And it's whenever I have a conversation with different family members, I tell them that there's really no one size fits all. It's just really, really, really take sitting down with your whole family and having that conversation. And then there's one thing you mentioned that I just want to pop this in there real quickly. Very important that we make our wills and all of those decisions and say them quickly enough when we still have capacity, because that's what is very important for our kids and grandkids to take our wills and our decisions our wishes and plans and act upon them. Because unfortunately, because now I do a lot of education and care around dementia, and we find that grandma or grandpa did not put any of these things down. And so the sons and daughters and grandkids are really struggling to think about what would have mom like, what would have dad like. And so I often, when I get the opportunity, I say, it doesn't matter what age you are, make your will, write down your plans and desires so that people know and they can do what you would have loved when the time comes.
When the time comes. And this is so complex issue regarding people with chronic illness that they have to go home, especially with dementia. And when you go back home 6 months and come back here, because like you said, the medication is only like 3 months. To see the advancement in, somebody suffering from dementia, how far they've gone, they have to be here in order for them to do that assessment, even though you're going to have a lot of social support back home. But if like you said, if you have a will, you have a plan ahead of time. And one thing with a lot of our people, we don't think. I remember talking to somebody that as you get older, you're going to become sick. She said, "Oh my God, I forbid. That's against, I forbid. God never had let that happen." I said, "It's reality. Whether you live up to 90 or 100 and something, you're going to have health issue. And that realistic part of thinking needs to be built in our brain and which it comes into also caring for yourself health wise, so we have to have that in our brain that one day, we're going to get sick. And if you're going to go back home and have a house there, you got rid of all your property here and you're coming back to your children here, whereby they already have their own set of life and they have their own children, they struggling to make ends meet and all that. So then you come back to them, what kind of living arrangement is that?
Yeah, there's a lot of, we have to think about the end of life. And we Africans, we don't like talking about dead or dying. So yeah, no, we don't talk about it. But we have to think about it, especially in terms of making sure that we think about what we would like, our desires and wishes.
Yeah,
And then we let our family members know. I have seen families go to court because of some of those things. I've seen families struggle. Mom and dad would have loved to be buried in America. They would have loved to be buried in Africa. Before you know it, there's animosity between the kids. for so long because there was no will that really articulated what this person would have wanted. So it's a service that we all need to do to the rest of our family members. Everybody, not just older adults, everybody should have their will, have their plans and desires and wishes in place. So
You also look into how acculturation and discrimination affect these choices. How does this experience, feeling of included or excluded, shape where people wants to grow old?
it's another very tricky piece because when you think of acculturation, basically acculturation is the psychological process of kind of changing and accepting the new culture that you're living in. And there's the researcher Barry has like 4 domains of acculturation that we can go through. One is assimilation. You lose everything old, pick up everything new. One is this 3. One is integration, basically trying to integrate both cultures. And then the other one is trying to forget. I'm literally forgetting what it's called, but there's 4 different ones. There's 3 key ones that often come up. And this is the third one of that, which is forgetting everything new and trying to live in the old. That is almost often very impossible. And so what we typically find that a lot of people are trying to do is the 2, assimilating, forgetting everything old and taking up everything new. That is also very impossible because there's some things about us that we cannot change. And so it's like you can't completely forget everything old. So what we often find, and we often get a lot of people in some sort of integration where they're integrating aspects of their old culture and also aspects of the new culture. And typically, that's where research suggests that it's kind of healthier and has more positive outcomes because you're not necessarily abandoning yourself entirely. You're just trying to live in a bicultural way. And we find that for a lot of African immigrants, that's where we try to live. And it's funny because our kids who were born here to parents that were born in Africa are very bicultural. It's like they can show up and be very American and you don't know whether there's any African in them. And then the flip and the accent and everything, it's African. And you're like, whoa, that's very, very bicultural.
Yes.
But the challenge that we find is that the research shows that for those who came to the US older, 50s and older, typically the accepting of the new culture is a little bit slower. And so that affects the way they can tap into a lot of the systems and resources. With older adults now, we're getting people who try their best to integrate, but the integration is a little bit slow. And so it can impact access to a lot of resources that they might be able to qualify for. And so that's the piece that whenever we're doing a lot with older African immigrants who come here, we really think about, yes, do your culture. I think a lot of it things comes to the food that they eat is very, very African. That's the group that typically doesn't really do a lot of dietary changes. But we say modify it in a way that fits your health. So for those who have diabetes, how do we modify the heavy starchy foods that we typically eat in a way that really doesn't impact their health negatively? For those who have hypertension, how do we do the same thing? But a lot of the research around acculturation shows that integrating is good. And so we typically try to support people to do some sort of integration to maintain their health and well-being. And then also really thinking about how do we expose them to different aspects of the US society that can benefit them in terms of health and outreach and education. Yeah.
Yeah, and that's very important. I mean, I've heard some people say, we've been eating yam. My great grandparents, they eat yam, they eat all this food, nothing happened to them. Without understanding that your grandparents and all, they're very hard working. They could walk miles without even thinking about it. They are very active and they don't consume so much at the same time. They are limit. They don't even eat sugar that much. I remember a friend telling me a 90-something-year-old mother never tasted sugar before. When she wants to eat, she doesn't even know what it tastes like. When she wants to drink pap, like it's made with corn, they put sour water inside or look for lemon or lime to put inside. That's how she could taste it. We are not thinking that those people who live in a different time and they were exposed to something completely different. So we cannot just continue to eat. And like you said, you could look at our food and say, okay, maybe instead of you want to eat African beans, make African beans, make beans with more moi or akara to give it a different tastes and all that stuff. So it's part of those education, and I'm glad you're bringing it up. And let's talk about cultural identity. I found that many older Africans, like you said, still identify more with their countries of origin than being America. Why is that? And how does that influence their sense of belongings and retirement decision? Because I remember having a conversation here with older Africans, and I said, "How do you identify yourself?" And they said, "Well, I'm a Nigerian American, I'm Togolese American, and all that, So how do you think that have an effect?"
That is a lot. I haven't primarily done the research, but I would take our response to it using a life course approach. So if you think of the where in the life course a lot of things are happening for us. In early adulthood, we're still developing. In teenage years, you're still developing. Even your identity, all of that is still developing. And so the identity that you form in the end is heavily dependent on what are the factors that were surrounding you as you develop that identity. And so you often find that those people who are coming to the US before, let me say, 45-ish, 40, are typically able to quickly adapt and kind of form different identities because life was they're younger, and so their identities are still malleable and forming. Whereas you come to the people who are over the age of 50, most of in the life course, you're now getting towards older adulthood. Maturity has set in. Their jobs and professions and careers and all of those things have set in. So the identity as well has also set in. And so by the time they have the identity, you take them out from the different community and the identity has already been set in them. So it's almost a little challenging to take out that identity and give a new identity because in the life course, all of that has already happened. So think of all of the psychologists that were talking about life stages, life cycles, and what is happening at whatever ages. For them, identity formation has pretty much really solidified. And so once you're having that type of identity formation that has happened, it's difficult for you to now be changing your identity completely to say, I'm American without any African, because that identity is already formed. And so those are the people who, would typically try to integrate in the new cultural context and then form an identity and figure out how to live their lives in a way that meets both sides. But it's the younger people. It's almost the thing where you find that oftentimes kids who come here before the age of 15 lose their accents completely because they were much younger identity. All of those things have not been formed. And so it was very easy for them and their growing process to be able to take in all of the new environment and then live here longer and grow into an identity that is very different from the person who comes younger. Because of the life stage and what has happened, all of those things form. And so by the time people get here, the changes that are happening now are building on who they are as a person, as an individual. And then the last thing that we'll talk about is where they settled. Where they settled. If you come and you settle in Minnesota, we have a huge ethnic enclave in Minnesota where within 10, 15 minutes, you can access all of the foods that you used to be able to eat back home. You're more than likely going to be able to continue eating those foods because your identity is fit with the foods, your cultural belonging and context fits with the food, and you can find it. But if you still had all of those identities and you went to a place where there's no food at all, you might have to make do with what you can. Or if some people travel, that's the other side of it. Some people travel the fly to different places and buy a lot of food and bring it back. But there's a lot of adaptation that happens depending on where you settle, is the point I'm making. So there's a lot of contextual factors that are impacting your internal identity, how you perceive, and then how you engage in it and live your everyday life. So there's like a multiple complex process that is interplaying there.
And I want to bring something so funny in your research. That identity also take place in your qualification of who you think yourself. And I remember reading one part when a Ghanaian man said, I'm going back to school to get my PhD. So when I get home, of course, people will know me. They will respect me. They will call me doctor, which is also part of why some people may choose that. I don't get any respect here.
Yes.
Because another part of that conversation is Africans who are employed on that lower than their qualification.
Yes.
And they feel that lack of respect, that they just do any job. You could have a PhD and be driving cab, have master's degree, You still work on a lower level because of where you come from. People don't give you that opportunity to move ahead because of your accent. You are not part, part of this.
Yes, yes. Yes, the qualifications piece is a whole different thing that we would need a whole different hour to begin to talk about how first what the decisions that people have to make to leave with those qualifications to come here. Because some people already think about it. It's like there's a lot of decisions that the family has to make to say, I'm gonna give up this position, this respect, this title, and come here. And oftentimes as a child of African immigrants, it's often for the kids. It's like we want better opportunities for the kids. And so the parents might say, I'm going to give up all of my success, my identity, my profession to come here for the kids. And then they come here, and that often has a lot to play. And we didn't even bring in the gender dynamics, depending on who's giving up that degree, that profession status. Is it the woman or the man, and how that affects the family and how that then affects the well-being and everything. So that's what I'm saying. There's a lot of things that play into that. But we found that unfortunately, the system here, it's much slower to be able to get a lot of our brothers and sisters who have degrees, especially quickly think of the medical ones, because those are the ones that actually have a path to translation. The physicians, the nurses, midwifery is a little tricky, but primarily physicians and nurses, those are the ones that have a laid out path to transition. But there's a whole bottleneck and a whole backlog of trying to get African immigrant brothers and sisters who are nurses and physicians back home in their country of origin to then transition and work in healthcare here. So oftentimes they come and they're working as home health aides, certified nursing assistants, and all of these jobs that are very different from the positions and the jobs that they used to work back at home. And that affects the identity a lot.
And it's part of the challenges, especially knowing we Africans were very, we have not proud, I would say pride in who we are. And when you are in a place when anybody could just talk to you, as if, look at you that you don't really belong because of your accent, even before, because even you want to change your name, even our children who does not even have the accent, the moment they look at their name, they know they are not actually originate from here because unless, they are part of those Africans who their last name is like Beecroft or Lawson or something like that, that we could talk about. And this is so important for us to actually continue to have that. And you talk about the social aspect of things. A few weeks ago, I received a call from my old job because I'm retired too, of one of my fellow Nigerians who has been working at this job for so many years, 77 years old. And he didn't retire. He was in a meeting and he just collapsed. And that's how he died.
Oh my God.
So the whole idea of saying, if I retire, even though he's entitled to retire, he has 3 children who are successful. What can I do if I retire? Where am I going to go? I go to Costco right by my house here, and there's a Ghanaian man. He's very energetic, but you could tell he's due for retirement. I always say hello to him. I've known him for over 30 years. And I always say, my brother, when are you? I call him my brother. When are you going to retire? He said, my sister, if I stay home, I'll die. He said, my only time that I take vacation is to go back to Ghana and come back. And I have to be working because I just can't see myself staying home. But, there's so many other things you could engage. And that's where the acculturation coming, you could engage in. And then find out what are other things that I could do. I could join the gym. I could, do so many other things. I could find some things that I've never been saying that is part of my interest. What is it out there? So can you just shed light in a lot of these dynamics?
Africans were very, very, that's the other piece that I'm probably going to, we're very community oriented. We're always in community. That's very different from the American society in general. In Africa, the default is being with somebody in someplace else. And it gets tricky for a lot of older adults in particular who cannot on Sundays after church. Because after church for a lot of African older adults is a friend A's house, and B's for a susu, friend C for a catch up, friend D. And by the time they get home, they shower and they go to sleep. And so it's that very community activist culture where we're always thinking about one another. But that's very different from the US society, which is more individualistic. It's what is the need for me? What can I do for me? And so you get that mismatch where people are, they just can, it's difficult to leave and try to think about what can I do for society, especially in a place where you're not connected to anybody else. And so people now start struggling to figure out what they can do. And I remember I was saying that in the acculturation, it's almost impossible to not change because the environment has changed. If you can be somewhere where one fundamental thing has changed and then you don't change. So that's where again we think about the integration of really helping older African immigrant brothers and sisters think about what they can do differently, which you're talking about, what other interests do they have, and then depending on where are they connecting? Where are they connected? Is it church? Is it work? Is it a cultural group? Is it a library? Is it gardening? What it is that we need to do to be able to start identifying places of spending our time and giving back in a way that helps us and supports us. Because I absolutely agree with those older adults. Like staying at home is not something that the average African person is used to. We're very hardworking people, and it's almost impossible for Africans to not be working. And so telling somebody to stay at home continuously, it's like, I can't do this. So it's almost like, how do we channel our energies? And I don't know, I've lived in Maryland and Minnesota, and I know that in these two communities, there's now a recognition because of the sheer number of older adults that are in these two communities. They're like, we need to do something. And 2 weeks ago, I was actually in one of the counties in Minnesota where we literally brought a group of older adults together thinking about what are the programs that we need to start doing, gardening, crocheting, exercise. And so I think it's what you're talking about. It's exactly what a lot of communities are beginning to think about. How do we get these people doing some of the things that they used to love doing in this new land that is very different from where they grew up or where they anticipated that they were gonna spending their retirement. Yeah.
Yeah. And we have to train our people sometimes about all those inner conflict that we have among each other to understand that, okay, you are in a crochet club, you're just there to crochet. That's all. And to be among each other, maybe to talk about social issue that is going on in the society instead of personal things, unless you feel comfortable sharing something with another person. Thank you so much for that. So I want
Can
to
I have one thing? The one thing that I want to say, because the flip side of this conversation is that I do a lot of talking with the older adults, but I don't talk to their children. And so we often think about how the older adults themselves came to coming to the US, especially in their older ages. Many of them can come now through family reunification, where they're coming to meet their adult children and they're coming to support their adult children, take care of the grandkids. And so I want to make a plea as somebody who's the older adult whisperer, because I hear from a lot of them, they are calling on all of their kids to ensure that you take them out. Because some of the kids, some of the grandparents are with the grandkids Monday through Friday, and then Saturday and Sunday, even when the kids are home, they're still with them and they're still in the home. And so the older adults are like, what if on Saturday or Sunday you took us to someplace else where we can just do something else and be with our people who are age mates so that we get a break from taking care of the kids. So that's my plea to the adult children of older adults who bring them, to just ensure that you're also giving them time away from they love their grandkids. They enjoy taking care of them, but oftentimes they're just like, give me one day where I can go hang out with the other older adults in the community. I know for those of us who are in Minnesota, the Manka community, we have our monthly meetings and many people bring the older adults, and that's where they connect. They get together, we do the cultural food, the cultural dances. The Nigerians here do the exact same thing. The Ghanaians do the exact same thing. So we're beginning to do those things, but that's what the older adults are calling for. Time away from the grandkids that they love to take care of or to do it, but just time away so that they can just hang out with the people who are their age mates and stuff. I know the Somali community here has a lot of adult day programs actually now for the older adults, where for like 4 or 5 hours during the day, they get tea, they do things, they watch Somali TV and all of those things. So I think that's where we all are going. It's very encouraging because the older adults are speaking and the children in the community are hearing, and they're developing a lot of programs for this.
I'm so happy to hear that. I'm so happy. And even if they're taking care of the children, when you come back and they take care of your children all day, take them out for a walk as a form of exercise. Okay, take them out for a walk and, bring them back home, let them do some stretches and all that stuff while they're at home. So that's so important. Thank you so much for contributing with that. So on discrimination and experience and healthcare and coping. Now, your second study actually struck me. I told you before we even got in, but I'm not surprised because I could relate to the experience of all those people who participated. It's his title. All I know is that there's a lot of discrimination. That's such a powerful statement. What led you to explore discrimination among African immigrants specifically, the older African immigrants?
Oh, what led me? So racial discrimination is something that it was particularly perplexing for me to observe because for the longest time for myself, and we've talked about this with a lot of African immigrant colleagues now, when we're back home, at no point do we ever think of ourselves as black people. I was from Mancon, my friend was from Meta, this was from this tribe. That's what we thought of. The tribes that we come from, the languages that we spoke, the villages that we come from. And then maybe, just maybe, the other thing we thought about was, oh, this person is fair skinned, I'm dark skinned. And so that typically came up a lot in who is the standards of beauty in the community, maybe depending on who you are, because I find that it's always very different. So people are like the light skinned people are beautiful. So people are like the chocolate people are beautiful. And so that will come up in conversation. But the idea that I am black was not something that really I thought of. But that's actually when you come to the US system, all of us who are a shade darker, especially those of us who are originating around the sun and with the dark skin, we're all considered black persons. And there's really, based in the US and the history of slavery and discrimination and all of that, there's a lot of things that has happened and that we Africans just come in and were put together with this group. And so I've always been curious to understand if how Africans are thinking about this and how they realize that is happening. Because for most of us, I was talking about it with a friend at this conference the other day too. We don't realize it immediately when we come to the US. It takes some time. And then once you realize it, you go back and think of everything that happened. You're like, oh, that's what was happening there. That's what was happening there. That's what was happening there. But until you realize it, it's like, oh, you're just living your go happy life. So I was always curious personally, because for me, I realized it when I took a class at in undergrad. It was an African American history class. So I took that class, came to a realization of what racial discrimination was and the experiences. And then I went back to think about when I would leave high school and I walk into there was a store that was this Rainbow Junior store. I was a teenager, and so I guess we're shopping at that store. And I walk into the store. My best friend at the time was Ghanaian. We walk into that store, and people started following us. Every time we walked, it was at a bus stop. So when you came waiting for the bus, it had glass windows. So you go into the store, you're walking around. When you see the bus, you walk out. And every time we walked into the store, one of the customer people would immediately start following us. And it wasn't until I had left to go to undergrad that I was like, that was discrimination. And then now, once you see it, you couldn't unsee it. So I was curious to see how, especially our older adults, who is discovering discrimination when and how it's showing up for the older adults. So that's how I came into studying about racial discrimination and how it was happening for our older African immigrants in the United States. Yeah.
And thank you so much for that, because you went to college, you took Black Studies. If it's not part of not everybody, like I've said it many times, is go to college and require, even when you go to medical school, to take Black Studies. But because of your journey, your area of study also tapped you to take that class. If you didn't take it, you may not know. And not to talk about African immigrants, because people think African immigrants are like the Latino who speak the same language. Okay. Like I told somebody, there are more French-speaking Africans than the whole Europe, you know? So you have some who may not even know how to read and write, but then they don't even know what issue of race is because they are busy with everyday challenge that they have to face. And thank you for talking about that. And in your study, you also talk about discrimination that goes beyond race, which this brings me to your accent, the country of origin, the religion. When you wear hijab and you dress differently, people will look at you. Okay,
Yeah.
like where are you from? Can you unpack that for us a bit? and how I would even say immigrant experience discrimination among other people of color as well, which was talked about before.
Yeah. So if you think about what racial discrimination is, prejudice against an aspect of your racial ethnicity. So depending on what the prejudice is pertaining to, is it your country of origin? Oftentimes it's your skin tone, and there's definitely different levels of racism. So the one of my colleagues, Dr. Hardeman, it talks a lot about structural racism, which is reinforcing systems that make sure that you're really at a disadvantage. But a lot of the racial discrimination that I particularly study, it's what is happening interpersonally. So it's what is happening between two people. I know in the article that you're talking about, there was also an experience of racism related to the police in that article, but that's kind of like at a structural level. But a lot of what I study is really the interpersonal level of racism, where there's an insult against you. I think a couple of people in that article talked about go back to Africa, go back to the trees where you come from, your monkeys, and all of those derogatory things that people really use against persons of African descent. And then there's also discrimination now that happens by religion and faith based. And so you find that for brothers and sisters who practice Islam, it's like there's discrimination against their hijab and all of those things that are part of their faith. So discrimination can come, unfortunately, in many, many flavors. But what we're finding in the literature is that across the board, discrimination is a stressor. And so as it stresses you, you go through the whole biopsychosocial process that then impacts your health, and thinking about your stress hormone levels begin to stay really high. And as they stay really high, you're prone to conditions like hypertension, diabetes, and research has shown that racial discrimination in particular, which is the discrimination attached to your race and ethnicity, it's related to a lot of these chronic conditions. A lot of the studies have been done in our African American brothers and sisters, those who were brought here or stolen and brought here. Some of the outcomes we're also finding in the studies that we're doing with African immigrants, that it's also associated with those poor health outcomes. So the racial discrimination is skin deep. It's happening for people think that is just an encounter that is one to one, but it's getting under the skin and it's impacting health. And the other thing that I don't think you brought this up, but the other thing that I study is hair discrimination, which is often also happens to us who have this hair texture, and it's the exact same thing. It's deeper than hair. That the discrimination you're facing because of your hair actually gets skin deep and it's also impacting your health. So across the board, racial discrimination is impacting our health. And it's one of the things that we really begin to think about. How can we really stop racial discrimination? Because it's been impacting the health of African Americans in the US for the longest time, across the board, from the interpersonal all the way to the structural and systemic racism and discrimination to also those of us who are new to the country.
Yeah. I remember a friend telling me, which happens to me too, whereby he doesn't eat his food. Because few times that he took his food to work to eat, and the moment he open it, warm it up in the microwave, take it out to eat, and this next thing is, what's that smell?
Yes, yes,
What is
that's
that? And this
unfortunate.
man will not eat until when he gets home. Okay. This is a person that is over 60. He said, I don't eat anything until when I get home because I'm not used to going out to eat sandwich, go and buy a burger outside to
Yeah.
eat.
Yeah.
I cook my African food so that I could eat. But if you're an Italian, is it of cheese? It doesn't smell bad to you. And I experienced it from the job where I retire from, where a Latino young lady who sits next to my office that has a closed door. Anytime she knows the time I'm supposed to eat. And the next thing, even though my door is closed, I'm eating in my office, and she will come out and say, what's that smell? And she calls other fellow co-workers to come and smell, and they will start spraying. So in a place where it's predominantly the people of color. So that's why I said, when I read that research, I was like, I mean, it's something that hit me because it's what many of us experience as an African immigrant. Which brought me to what I wanted to. I find it interesting that the participant described this coping strategy when it comes to experiencing discrimination. Some of them turn a blind eye, or some react to it, which is what I do, or avoid it completely, which is what this my friend does, that I'm not going to eat at work. I could starve myself and drink water until when I get home. Which of these
Yeah.
do you think has the greatest impact, for better or for worse, on health?
Honestly speaking, I haven't done the research to figure out which is the best coping mechanism. Yeah, but you're right. They all do it in opposite ways and reacting to it versus not reacting to it and then turning a blind eye to it. You can ask the question because in that paper we talk about turning the blind eye to it. But if you see it, can you really turn a blind eye to it?
Yes.
Once it's seen, can it? Because it's almost like you can't unsee it. And so that's one question that I'm asking myself as a researcher, and I'm hoping to begin to explore that a little bit more too. But that's something we got to explore. A lot of some of the coping research says active coping is typically better than passive coping, but which we say all of this to say that active coping in using ways and strategies that are positive because there's some people that actively cope with alcohol and other things. And so you don't want those types of negative health habits related to it. But some of the literature has talked about how doing something actively to cope is much better than not coping at all. But it's tricky. And I think what I've always end up suggesting and helping people to think about is really think about what is best for you and or what do you need to support your coping with it. So the good thing too with Africans is as faith and spirituality. A lot of people take the active coping through faith and spirituality, prayers, dancing, worship, meditation, all of those things, regardless of whether you're Muslim or you're Christian. A lot of people pray about some of those things. And so that's one aspect of really beginning to think about it. The other way of actively coping that I found some people do is be resolute. I think one of the participants talked about it in the article where they're just sure about who they are and what their culture is and being actively who they are. And I can think of it in terms of many African immigrants who, when they recognized colonialism, the evil effects of colonialism and stuff, they went back and changed their names from all of the English names that they had, took it out, and stayed with their ethnic African names. And that's a way of coping with it. It's like they're like, I'm going to be authentically African across the board. I'm going to give my kids all very African names. I'm going to have only an African name. And depending on what country you come from, the middle name typically used to be like an English name or some sort of name that was descending from the colonial masters. So most people took those names off their names and their identity. And so there's lots of ways that people actively cope. And so I guess as a clinician now, my recommendation is if you're going to choose active coping, really ensure that you're not getting into negative habits, health habits, because those are also not good for you.
So that sense of pride of who you are is very important. And we cannot suppress it because it, like you said, it affects your health, you know, cardiovascular health, because you think about all these things and
Yeah, the stress from it. Yeah.
yeah,
Yeah.
yeah. So some immigrants, especially those who are new, may not even recognize certain type of discrimination because of the cultural or language barrier. How does this lack of recognition affect their experience?
Oh my God, that's a research question that I want to answer right now.
I think you are.
I literally have been thinking a lot about that research question and really thinking about is it better not to know than to know and then try to deal with it. And honestly speaking, depending on what day you talk to me, I go both ways, but I have not done any research about it. But the piece that complicates that question is globalization and African music and African culture and how far it's gone today. Today, you walk into a mall, you hear Afrobeat. You go on Amazon, you find African print clothing and all of those things. So, how is that affecting discrimination? How is that affecting racism? How is that Nollywood is, I think they said, is the second biggest film industry now. So, the movies are being watched by everybody across the globe. Granted, some movies are actually more American than American movies, but there's a lot of cultural movies and there's a lot of culture that is still imbibed in those movies. And so the question then is, are we getting from a post-racial, not systemic, because systemic race and structural racism is still existing and it's going to take a lot to dismantle it. But I'm talking just about the interpersonal and the way globalization is affecting everything. How does that then affect the interpersonal interactions around racism. But we also know that there are people who are not exposed to any of this music at all or this culture at all and have no idea. Maybe those, I would maybe just guess to say some people in really rural areas in the US do not interface with any other cultures at all. And so they're often grown in their own cultural roots and have never been encountered people that are outside of them. How does that affect the way they'll treat people from other racial and ethnic groups? We need to study that. And that's kind of like what I've been contemplating for the next kind of
Well,
work.
please study that, please. I'm glad you're coming up with this question. You're coming up with different topics because I can't wait to read all that. So, do you think there's a need for more community-based education on immigrant rights? And what do you do when you're facing discrimination in terms of educating a community?
Oh, yeah. There is always, especially within the African immigrant community, there's always a need to educate around our rights. I want to say this in a good way. So, what I have found, I haven't done any research on this, so I'm just going to say it as anecdotal evidence that I've collected, especially for a lot of African immigrants, general first response is to follow the rules that we see. If you go into a room and they say do A, B, and C, the first thing that we try to do is look at A, B, and C and try to follow it. What I've found in other communities is that the first thing is question why A, B, and C. So that's an outlook that puts you in a different place. If you question A, B, and C, then you're really able to explore and see how A, B, and C can fit with you and your whole outlook and your whole being. But if your tendency is just follow A, B, and C, that means you're just following without really understanding. And I say all of this to say that in the US system where structural discrimination and systemic racism is baked in, if you're not questioning policies and rules, what often happens is that you're literally just working within systems that might not have been built for you, and you're not asking or questioning why. So that's, if that answers your question, it's really begin to reframe our scope of thinking. Think about maybe just look and see why are we doing A before B and B before C? Is this normal? Is this really how it should be now for those of us who are here versus how it used to be in the past? Because of kind of how our systems in the US have been built, a lot of it was really tapping into biases and systemic and structural biases that come from racism in the past. And then people like us who typically don't question rules are really just doing things because they were there and not questioning them.
Yeah, that's true. And so we almost finished anyway. So based on your work, what can healthcare provider or community leaders learn to better support older African immigrants?
I'll give community leaders are doing a great job right now. A lot of community leaders across the country are thinking about what do the older adults need and what can we provide for them. What I want to speak to is my brothers and sisters in the healthcare system. We really need to begin pausing and practicing cultural humility. And cultural humility is really the idea that I don't know too much about you. You are the best person. You have the expertise on you. So what I need to know about you is to pause and ask you, what exactly do you need? And so that is that cultural humility where we're not making assumptions. We're really thinking about, is this medical problem the most important thing for this person? If I'm having them come in and they bring a daughter or a grandchild, let me not assume that the daughter or grandchild does not need to be in the room because actually for a lot of African immigrants, we have a very community culture and it doesn't matter if the mom or dad speaks English very well, they still need that support person. So that cultural humility of pausing and really taking in what does the person need, what is their culture, what can I do to accommodate that culture is very, very important because that's our cultural background. And for a lot of the older adults, that's what makes them very comfortable to know that their family member is into the room, to know that their own values are taken into account for their healthcare and all of those things. Cultural humility is one of the biggest things that I will be recommending for a lot of
I
practitioners.
see that in Latino community too, whereby the grandchild follow the grandparents, to healthcare facilities, to
Mhm.
grocery store, to anything that they're doing, because sometimes they don't even speak English. So the grandchild be the one to translate for them. And also for the policymaker and researchers, what area do you think still need attention? Which I know there's so many.
For policymakers, we need to be thinking about policies for all of the groups that we're representing. We find that you're making policies that have been primarily supported for benefiting one cultural community and not the rest. So if you're a policymaker, pause and go out into that ethnic enclave that is very different from the rest of your district, the rest of your community, and just find out what their needs are. I know for those of us who are in Minnesota, I'm very actively involved with the legislature. And so I'm always up there talking and having conversations. And those of us are. So that's what we need to be doing, engaging our policymakers and calling them to come out into the community. They're there to serve us. So calling them to come out and really engage with us and getting to know what our needs are and telling them what our needs are. It's in that interaction and engagement that we're going to be doing what is good for the entire community and really thinking about policies that are good for a lot of people, because what they say is a rising tide lifts all boats. If the water rises, all of the boats are going to come up. So that's really what we need to be thinking about as a community now, and really thinking about policies that are good for.
Yeah, and that's so important what you just said, because I remember recently, was it 2 years ago, somebody posted on Instagram, was it Instagram or WhatsApp, that a researcher from a college looking to study Ghanaians and mental health among Ghanaian community. I said, would that Ghanaian community only represent other African community? Who is actually doing these studies based on only the Ghanaians? I had to challenge it because it's beyond
Yeah.
studying. They're going to use that studies to generalize on other African immigrant community as well.
No, so that so I'm a researcher now, so I can see both places.
Yeah.
There's a lot of things to think about. Where do you start? Do you start with one community or do you start with all communities? And it really depends on resources, access, and all of those things. So there are times when we should start with one or two communities to ensure that we really understand that. And then my whole point is don't stop.
Yeah.
If you start with Ghanaians, make sure that you understand Ghanaians. You go to Nigeria, you go to Cameroon, and you go to the different cultural communities, so that we're gathering a body of knowledge that is going to inform health for all of the African immigrants. But yeah, I don't fault them for starting with one cultural group, because it can be, depending on who you are and what access you have to the community, it really makes sense that you should start with one cultural group and really understand them very well, versus trying to start with, or if you start with 5 countries and you only have 5 Cameroonians, 5 Nigerians, and 100 Ghanaians, then really just confuses the interpretation. So then it's like, maybe you should have just done Ghanaians. So that's where the researcher in me is just going to be like, yeah, there's good things too for that approach. Yeah.
Yeah.
Mhm.
Oh, wow. So thank you
Yeah.
so much. I could keep you here all day because, there's so much that wisdom that you're able to share. And I really want to thank you, Dr. Nkimbeng. Thank you so
Thank
much for this enlightening conversation, because those who are going to listen to this, we have so much to gain from it, and we need much more research in area of studies among African immigrant community in America. Because when I look at Canada, they have so much research being done on African immigrant, but in United States, it was something that it is so rare. So when I saw I said, no, I have to call this doctor. I have to get her in. We have to talk more, because it's something that I don't really see too much out there. So your research not only give voice to the experience of older African immigrants, but also challenges us to think deeply about what belongings, identity, and aging means in a society that often overlook this group. Your work reminds us that home isn't just a physical place. It is also where we feel accepted, supported, and seen as a part of the community and part of the environment. So to our listener, thank you so much for tuning in to Pansa Pansa podcast. We hope this discussion help you to better understand the reality behind the migration. That's it doesn't end with arrival. Not just because we arrive here that's the end of it into a new country, but continue to across a lifetime of choices about where and with whom we feel at home with. If you enjoyed this today's topic, don't forget to subscribe, share, and leave us a review. Let's keep this conversation going about what it means to belong, no matter where you came from, and where you grew old. Until next time, take care and stay connected.
Thank you for tuning in to this episode of Ponza Ponza Live podcast. We hope to have you back with us in the next episode as we continue to explore the nuances of the African immigrant experience. If you'd like to connect with us, you can email us at talk@ponsaponsa.org. That is TALK@PANSAPANSA.org. And follow us on Instagram at pansa.pansaforum. Until next time, remember to spread kindness and love. Thank you and take care of yourself.